Hey, y'all. Hey, and welcome to NeuroInsights with Dr. Naeema. I'm your girl, your host, Dr. Naeema, bringing you the latest in neurodevelopmental insights, straight from the world of brains, minds, and all things that make us us. This is episode 6, and today we're diving into something near and dear to my heart. And I know many of yours as well. It's a big topic, one that often comes up when we're talking about ADHD and autism. And the topic is cognitive assessments. So buckle up, folks. Y'all, this won't be boring and it won't be long, but it's definitely going to give you some insight. I'll be breaking down the differences in how we assess these conditions, the challenges that come with it, and how to really understand the results and their implications. This is going to be helpful for clinicians, individuals, families, so that you can better understand what's happening and how do we make progress. Now, let me just say, cognitive assessments can sound a little intimidating. Okay, maybe a lot intimidating. I mean, who doesn't get a little nervous when you hear the word assessment? Right? It's like, oh my goodness, do I need to study for this? But don't worry, I'm here to walk you through it and we'll make it as painless as possible. So let's start with why assessments for ADHD and autism are so different. Well, imagine this. You're sitting in a room with a child or an adult and you're trying to understand what makes their brain work or what is stuck. You're thinking of a gear. Think of gears and how they just go so smoothly. You're trying to understand what is happening with the gears in the brain of this person. ADHD is often about attention, focus, impulse control, and hyperactivity. Auditorily, how we hear things, verbally, how we speak, what we see, and motorically, how we our movement, things that you can clearly see in action. Autism, on the other hand, is typically about social communication, sensory processing, and repetitive behaviors. Now, here's the kicker. We have to assess each of these areas in very specific ways. Let me backtrack. It's really an honor and a privilege. We get to assess each of these areas in very specific ways. The ADHD assessment often includes tests for executive functioning, and this is how well someone plans out tasks and execute them to the full completion, organizing and managing their time. We're looking at attention span, memory, processing speed, things of that nature. For autism, however, we're diving deeper into social and emotional cues, like how a person reads facial expressions or navigates conversations. Are they able to understand those nuances in communication, like jokes that are not explicit or concrete? These are very different aspects of the brain and they require different approaches. But, and here's where it gets fun, what happens when someone has both ADHD and autism? Yes, that's like mixing chocolate and peanut butter, except they don't always blend so smoothly. When evaluating someone with both, we need to be really careful. The symptoms can overlap. You might have an individual who struggles with attention, which looks like ADHD, but they also have social communication difficulties that look like autism. Trying to tease out which behavior belongs to which condition can be a little tricky. But trust me, I've had my fair share of aha moments where I realized, oh, this is ADHD showing up in a way that mimics autism, not the other way around. It's a dance, y'all. I've spoken about this dance before. It's a dance. One of my most memorable cases was an adult who came to me in their 30s. They'd always been labeled as quirky or disorganized in school, and things never quite clicked at work. After a thorough assessment, we found out that they had undiagnosed ADHD and traits of autism. In adulthood, it was a game changer to put a name to what was going on. We helped them break down strategies for better communication and focus at work, which made all the difference. Also, with strategies to supporting them within their relationships at home. They went from feeling overwhelmed and misunderstood to empowered with coping strategies. Now, let's talk about the results. Once we've done the testing, what do those scores actually mean? Well, the results give us a roadmap. If you're an educator, it might mean understanding how the child will learn best in the classroom. If you're an adult with ADHD or autism, it might mean knowing why you're struggling with certain tasks at work or being a parent and what accommodations can be made, why you are struggling to be present in conversations, and how to make progress with hiccups in life, within your home, within your community, within your work setting. For example, a child with ADHD might need extra time on assignments because their brain has a harder time organizing tasks, while someone with autism might need help understanding unspoken social cues in the lunchroom. Here's the thing that often gets overlooked: the results tell us more than just where there's a difficulty. They also tell us where the strengths lie. It's all about balance. With the right interventions, children and adults with ADHD and autism can thrive. So if you're a parent or a teacher, I'm going to say this loud and clearly. Knowing these things does not make someone broken. It's just like figuring out what kind of fuel your car needs. You wouldn't put the wrong gas in a Ferrari. Please, can I get a Ferrari? You wouldn't put the wrong gas in a Ferrari, right? It's the same with our brains. So when we get those results, it's about understanding how to support them in a way that works best. All right, so what can we do with these results? Well, let's talk therapeutic treatments and supports. For children, that could look like behavioral therapy, helping them develop coping skills, manage impulses, or even focus better in class. For adults, it might involve cognitive behavior therapy, which can also be used for children, or even just finding strategies for the workplace or in relationships, like breaking down tasks into smaller chunks, using visual reminders, and setting up specific routines, creating a workspace in the absence of visual and auditory stimuli that can pose as a distraction, time chunking, and intentional mind mapping with your time chunking. The goal is to help them feel confident and empowered. Yes, empowered. Because we're all about the power of knowing yourself and building your best life. Now, here's your action step. Stay tuned. Make sure you stay tuned. We've got some exciting things coming your way in the very near future. I'm rolling out empowerment development groups. So if you're someone who feels like they need more one-on-one support navigating life with ADHD or autism, these groups will be just the thing, and some of them will be self-guided as well. There's going to be a self-guided roadmap with check-ins. They'll be tailored to help you or your loved one with specific strategies, and we'll all grow together. I'll keep you posted on the details, and don't forget to subscribe to my YouTube channel, Dr. Naeema Giving Hope. You'll get tips, insights, and even a few laughs along the way. You can also follow me on Instagram and Facebook at Dr. underscore Naeema underscore and at Giving Hope LL. And I encourage you to join the Dr. Naeema Giving Hope channel community on Instagram for more personal insights. If you've enjoyed today's episode, I'd love for you to like, subscribe, and share this episode with someone who could use this information. It really helps get the word out and empowers others to get the support they need. Okay? So that's it for today. I know, y'all. It's over. That was fast. But I'll be back. The next episode comes to you next week. And know that good things come to those who wait. Y'all, this is really dope stuff. And I'm really honored to be on this platform and providing these insights. Like, it's really, really amazing for me. So I'll be back next week with more insights that'll have you thinking, that's it. I get it now. Until then, take care of yourself, take care of your brain, and keep being the awesome, unique individual you are. Thank you for tuning in to Neural Insights with Dr. Naeema. Be blessed and continue to be a blessing.